Thank you for the opportunity to share the efforts of our Antimicrobial Stewardship Project and results on the Adaptation of NICU Surgical Antibiotic Prophylaxis Guidelines. Patients admitted to the Phoenix Children's NICU are outborn, with approximately 1 in 5 requiring surgery. Through our involvement with a VIII initiative, we selected antibiotics for surgical prophylaxis as a focus. On review, 27% of surgical cases received a variety of antibiotics for greater than 24 hours. Our project was designed to examine the effects on postoperative antibiotic selection and duration during a 1-year study period after implementation of NICU surgical antibiotic prophylaxis guidelines, with goal guideline adherence of 90%. In 2016, we established our process for antibiotic utilization rate, or AUR, per 1,000 patient days and baseline. Next, we developed evidence-based guidelines in collaboration with surgical colleagues with guideline implementation of May 2018. From September of 2018 to August 2019, we reviewed surgical cases for antibiotic selection and duration in comparison to guidelines, with clinical evaluation of those with a duration of greater than 24 hours, using presence of a positive blood wound culture within 7 days post-op as a balancing measure. During the baseline period noted here in red, 16 different antibiotics were used. However, variation was decreased post-implementation to only 6, with none of those being vancomycin or piperacillin tazobactam. In review of duration, the percent of cases that appropriately did not receive antibiotics post-op increased by 16% to over 54% of cases, and all cases with a duration of greater than 48 hours were deemed appropriate on review. Results demonstrated an overall decrease in antibiotic exposure. When assessing elements of adherence, 90% of cases were appropriate based on duration, and 94% based on selection according to guidelines. When assessed in combination, adherence was 88%. And there were 0 positive blood or wound cultures within 7 days post-op. Looking at our unit AUR, with the blue line representing rate month to month and orange representing the annual median, you can see the resulting decrease in AUR with awareness and a more standardized practice. In summary, adaptation to guidelines was demonstrated with overall adherence approaching 90%, and this standardized approach safely reduced overall antibiotic exposure in surgical infants and positively impacted the AUR. We continue sustained awareness with monitoring and feedback to providers in collaboration with antimicrobial stewardship, with the opportunity to further standardize the homogeneity of wound classification for similar procedures. Thank you.